Okay, so welcome to everybody to this presentation that Stan and I'll be doing. For those of you who I don't personally know, I'm Barbara Sanders. I was Barbara Hunter at Williams. We're going to give people about another minute or two to log on, and I'm going to also mention that we'll be doing this presentation. We're going to have everyone muted until we do the Q&A at the end. So, but you can put your questions in the chat and we'll address as many questions as we can at the end of the presentation. So we'll give people about another minute and we'll begin. Okay, so we'll get started. So there are two topics that we're going to be covering today. I'll be discussing demystifying the Medicare application, and Stan will be presenting on do you have a will? So in terms of Medicare, in the next few months, most of us will be receiving mail about applying for Medicare. And within the next year or so, most of us will be turning 65. It can be an overwhelming process. I'm going to approach this as if most of us listening know nothing about applying for Medicare or about Medicare. There's a lot of information. I don't expect you to memorize this. And also each person has a different and unique situation and circumstances. So the goals is to acquaint you with the various terms in the regarding Medicare and also with the process. And I just want to mention that for both of these presentations at the end, we're going to provide you with a summary and some resources. Next slide, please. Okay, so factors to consider as you begin the application process will include if you or your spouse or partner will be working after age 65, if you have health insurance after 65, if you'll be receiving disability benefits, and also if you have pre-existing medical conditions. Next slide, please. So additional considerations include if you're living outside of the United States, if you're living in more than one state, if you're active duty or retired from the armed services, and if you're receiving Social Security retirement benefits or railroad retirement benefits. Next slide. Okay, so there's a whole alphabet of these different parts of Medicare, and they're constantly being remodeled. Some are added, some are removed. But I think that this presentation is current, at least today it is. So we're going to talk about Medicare Part A, which is hospital or inpatient coverage. It's known as original Medicare for those of us in the medical industry, in terms of nurses and social workers, as well as doctors, psychologists. We often refer to it as straight Medicare. If you've been paying Medicare taxes, it's premium free. Now there's a qualifier to that. It depends on how long you've been paying Medicare taxes. If you already have medical coverage through your job or your partner, it is a secondary insurance. So your primary insurance will pay first and then Medicare will kick in. For example, if you're still working, you have coverage through your insurance. You don't have to pay for it again. But again, there's that qualifier that I spoke about. Okay, next slide, please. If you have not been paying Medicare taxes, you'll have to pay a premium, and that will determine, that price will determine on a number of factors. I would recommend that if you have adult children, you should discuss this with them, because in the future, this could be an issue for them looking, in the long run. Next slide. Okay, so A pays for much, but not all costs. It does not cover most drugs. Some medical providers do not accept it. And the medical provider must be enrolled in original or straight Medicare. Next slide, please. Okay, so then we have Part B, which is outpatient. It covers many preventive services such as ambulatory services, partial coverage of mental health care, ambulatory surgery, acupuncture, and you can enroll when your employer-sponsored coverage ends. Now I'm going to skip over Part C for a minute, and we're going to discuss, next slide, please. Part D, which is coverage of medications. These are prescription drugs, and the amount you pay is adjusted according to your income. Next slide. So this is important to know. A and B alone do not cover dental, optometric exams, dentures, cosmetic surgery, hearing aids, or long-term or custodial care. And something that I would encourage everyone to consider or investigate is considering buying insurance for long-term care. You know, we're in our 60s, hopefully we'll live longer, but it is definitely something to look into. Next slide. So we're going to now come to Part C, which is Medicare Advantage. And C bundles the other three parts that we were just talking about: outpatient, hospital, and medication coverage. And just like there are different types of medical insurance, there are different types of Medicare Advantage plans. Some cover vision, hearing, dental, optometry, and there can be variation in the cost depending on where you live. So Medicare Advantage, you have to use the doctors and services within your plan's network. You may need a referral for a specialist, and it's important to know which plans are offered in your state, your county, and healthcare system. So for example, I'm in New York, but the Advantage plans that I have here in New York may not be available in Illinois, and they may not be available in Missouri. Also, 2 adjacent counties may not have the same plans. Next slide, please. So in terms of Medicare Advantage, in addition to A and B services, it also covers many preventive services, and as well as co-pays and deductibles. Next slide. Okay, so then there's also Medicare G, which is Medigap. It's also known as Medicare Supplemental Insurance. It's sold through private insurance companies, and it must include Part A and B. It usually includes Part D. And it's called Medigap because it fills in the gaps and reduces out-of-pocket payments for co-payments, co-insurance, and deductibles. Next slide. Okay, Medigap is not the same as Medicare Advantage. It does not cover long-term care or private duty nursing. It does not cover vision, dental, hearing aids, or eyeglasses. Next slide. So getting started, we've gone through this alphabet. Again, I don't expect you to memorize all these, but when can you start to apply? So you can begin to apply 3 months before your 65th birthday or 3 months after your 65th birthday. So there's a 6-month window in which you can apply. Next slide. Starting the process. So information and documents you may need include your birth certificate, proof of U.S. citizenship or legal residency, your driver's license, your social security card. Next slide, please. Documentation of current health insurance, your most recent W-2 form, U.S. military papers in terms of discharge if you were in the armed services, and statement of social security benefits. And again, you may not need all of these documents, but I recommend that you have them available. Now, in terms of statement of social security benefits, I'm going to come back to this item in a little while. Next slide. So after you open your application, you can start to add information, and you can return to the application and information will be saved. After you submit it, your Medicare card should arrive in 3 to 4 weeks. Now, I did have an interesting experience because I wanted to see what this application looked like. And actually, my husband, Charles, and one of my sisters applied last year. And I was trying to get a copy of the application for this presentation. And after a few questions, they told me in so many words that I was too young and to come back when I was a little older. So I don't have that information for you, but it'll be available when you apply. Okay, next slide. Okay, so late application penalties. If there's one thing you remember from this presentation is that the financial penalties are stiff and they're permanent. They don't go away. They're severe, punishing, and they're unforgiving. There's a formula that they use to calculate your penalties. My eyes were crossing just looking at this formula. I would just say, so that you stay out of the crosshairs, just make sure that you apply within that 6-month period. Next slide. So in summary, research is everything. Timing is everything. This doesn't have to be a steep learning curve on your road to getting Medicare. Don't get overwhelmed and get started soon. And again, so these are the plans: A for hospital, B for outpatient, D for medications, C for Medicare Advantage, and G for Medigap. Next slide. So just in summary, and you're going to receive some information from us. Medicare and Social Security, they have user-friendly websites, including frequently asked questions. Medicare has a 24/7 chat feature. I used it for a number of things for this presentation. On the left is the handbook, Medicare and You. This is the 2021 edition. The 2022 is going to be out soon. This handbook also comes in a digital form. It's an excellent resource and answers many questions. I also just want to mention for AARP, if you're not a member yet, I encourage you to become a member. You get a number of discounts. They have an excellent magazine with excellent articles. When you get your membership, make sure they send you a membership card because you're going to need that in certain instances. So I just want to get back to what I was saying about the Social Security statement. You need user IDs and passwords for the application and for accounts. Something that I suggest, and if we could have the next slide, please. That I suggest that you keep a concise list of important contact information for your loved ones. Including, this is a suggested list, but includes toll-free numbers, account numbers, and share this list with a trusted family member, either on a flash drive, in your safe deposit box. You can put it on paper in a secure location. This family member should know where this information is, because if something happens to you, your loved ones are already experiencing immeasurable pain and possibly grief. It's going to be compounded if they can't locate your will, your life insurance policies, your bank accounts, and a number of other information on here. Also, even if you're not able to contact or you pass away, your bills are going to continue to go. So it would be helpful to your family to be able to contact your utilities or your credit cards to let them know what's going on. And I really encourage that people should update this list every 4 to 6 months. Next slide. So in summary, 1979, there were a lot of events, a lot of good music, but we can't fit everything on this slide. It's just impossible, but just looking to the future, we want to say that the next few years are going to be just as good. I'm going to ask that we hold questions to the very end. And this list in terms of important contact information is going to segue into Stan's presentation. So I'm going to pass the mic to Stan, and he's going to talk about estate planning.
Thank you, Barbara. So Ashley, if you could put my slides up. Great. So we call this, do you have a will? It's just a common question that people ask of others. Basically, the topic is obviously much bigger than just a will, but it's sort of a shorthand term for estate planning, and estate planning is even a shorthand term for a lot of additional planning, not only for when you die. I want to preface by saying there are basically three categories we're going to talk about tonight, or I'm going to talk about documents that are operative while you are alive, your will, which takes effect when you die, and then there's a third category of trusts, which can span while you are alive and also after you pass. Next slide, please. So what we're going to do is basically I'm going to try to give you some basic elements of estate planning. Some of this may be entirely familiar to people on this call. Some people may know the topic better than I do, but I'm going to assume that people are starting with just a very, very basic need to have operative vocabulary and just a way to think about that. This is the purpose of this presentation. I want you to be an informed consumer. So when you go to work with your estate planning attorney, your estate planning team, you have some idea of the context in which you're working. So that's what we are going to do. What we are not going to do is anybody's estate plan tonight, because as you see, it's not something anybody, including me, can do in 15 minutes. Next slide, please. So this is the world according to me. I'm one attorney. There are thousands of attorneys that have been doing this for a very, very long time. It's the world according to me in about 15 minutes. So I'm going to keep stressing that this is a very quick slice at a very deep topic. I've given estate planning advice for 38 years to a whole variety of people in very different circumstances. And what I will also stress again is that your estate plan is unique to your circumstances. So it's less than useless for me to say, here's an answer for everybody in this room. The one answer for everybody who listens to this is going to be, you sit down with a good estate planning attorney to make sure your estate plan is crafted to you in your circumstances specifically. Next slide. So when you are planning your estate planning exercise, you want to think about the full context of your life. And I refer to this, I'm going to keep referring to your circumstances, and think about your circumstances globally. And we don't do that on a day-to-day basis very much, but in anticipation of working on an estate plan, you want to try to think about the entire context. So your age, your health, your family members, their ages, their healths, your nuclear family. If you have a blended family, families are always evolving, right? Family members are these happy occasions, they're being born, and these sad occasions when they pass. Your finances, again, make an enormous difference in terms of the nature of the estate plan that you should be contemplating and preparing. We all have knowns. We know how many siblings we have. We know whether we're married. We know how many kids we have. But we all have a huge number of unknowns. And one of the great challenges in estate planning is you're trying to draft into the future. And that's a difficult thing because the future's unknown. I can bore you with examples of people whose circumstances seem to be completely rock solid and everything was just going along as planned. And then life throws things at you. The slings and arrows of outrageous fortune is what Shakespeare said, right? So when we try to plan, we are planning into the unknown, which is a challenge. The estate planning exercise, what you're going to do when you sit down with an attorney will vary dramatically, again, based on your global set of circumstances. Next slide, please. And so this is a little bit tongue-in-cheek, but it's a way that I categorize when a client calls me. And I will say, and by way of full disclosure, I am not sub-specialized in high-end estate planning. That's a very, very complex area. So if you have very large net worth, you're going to be working with attorneys who probably do nothing but that type of estate planning. But my categories of circumstances I had a friend when I was a kid. We used to play sports together, and if you play sports, you're always saying like if and buts, and if I made that foul shot, or if he didn't step out of bounds before he caught the ball. And this friend had a grumpy old uncle who used to say, if a frog had wings, he wouldn't keep bumping his butt. Basically, like if everything was different, your life would be a lot simpler. So one large category of the clients I see are people basically frogs without wings. Like it's you're doing your best, you get a little bit ahead in life, and then circumstances pull you back. And your estate plan is reflective of basically just trying to think very in a very confined way, because that's the financial circumstance you're in, or the family circumstance you're in. But it's very important. It's a different kind of an estate plan, but it's I would describe it as one that is somewhat smaller, because the financial opportunities, for whatever reason, good or bad, are not particularly strong. The next category of people I describe to myself as being basically in Earth orbit. They've sort of left gravity, and life is financially kind of going along, and their relationships are going along, their family's going along, and they're not getting dragged down quite as much. And it opens up some opportunities for planning. But again, that group of people, not to sound all gloom and doom here, but it's life. Even if you feel like everything's swimming along in a really lovely way, you can be pulled down unexpectedly and through no fault of anybody. And then the final category there are referred to as the sort of escape velocity group. And that's the group that have left Earth's gravitational pull altogether. These are, sort of people with great amounts of wealth, and the planning opportunities there are extraordinary. And the exercise is a big one. I've been served as a trustee for a number of people that have a great deal of wealth, and their estate plan, it can be dizzying in its complexity, all very carefully thought out, all very well done, but it is a qualitatively different product than the person who basically is living, I won't say paycheck to paycheck, but living with modest resources. So the amount of your exercise, the amount of your assets and your circumstance will determine the type of estate plan you're going to have. Next slide, please. So another main point here, a takeaway, Barbara had mentioned, like if you remember nothing else, I would say if you remember nothing else, when you're going to do your estate plan, seek what I would refer to as wise counsel, a good attorney, a good estate planning attorney. This construct is something I came up with. I'm sure there's other people who are more deeper thinkers than I who have a better way of saying this, but basically at the bottom of this hierarchy, you have data, which is everywhere, then organized data is information, and then knowledge is organized information. Intelligence, you take knowledge and kind of look forward, but at the top of that hierarchy is wisdom, and wisdom is the stuff that I don't think artificial intelligence is going to get there anytime soon. I don't think, and I don't mean to pick on LegalZoom, but the idea of I'm going to go to LegalZoom and spend $40 and get my will, I don't think that's a good idea. I think using the medical analogy, it would be like saying, we're going to send you some IKEA instructions and some scalpels, and you do your own appendectomy or something. Like, just my advice, don't do it. Find a very good attorney whose judgment you trust and whose wisdom you respect. Next slide, please. So some basic vocabulary. While you are alive, remember I spoke about 3 different categories: documents that are operative while you're alive, your will, which takes effect when you die, and then trusts, which can be either or both. So these documents while you were alive, durable power of attorney, basically a power of attorney. The concept is you appoint another person who can stand in your shoes to manage your affairs. So if you don't die, but you are disabled, it's someone who can file your tax returns, pay your bills, have access to your bank accounts, basically do what you need to do, but are incapable of doing. That term durable, by the way, it just refers to a type of a power of attorney that it does not is not affected by your disability. There's a legal theory that says if you don't include the language that says this is not affected, this power of attorney will not be affected by my subsequent disability, the power of attorney basically gets torn up. So you want to make sure you're using a durable power of attorney. Your attorney, the attorney you hire, your estate planning attorney, will be well aware of that. Second document is a healthcare proxy, and that is basically a subcategory of a power of attorney. It appoints someone to make healthcare decisions for you if you're unable to make your own. Importantly, it does not articulate what those decisions should be. So I have that note there to communicate with your proxy holder. Don't appoint someone your healthcare proxy and then not express their your wishes to that person. You don't want to leave them just kind of hanging there without guidance from you. The third category, which we use as a living will, sometimes called a declaration of healthcare directives, and that is where you articulate what your desires are. Most people will say, if I'm in a persistent vegetative state and I have no chance of recovery, I don't want heroic measures. I want to be allowed to die naturally. But it's a document that says those things so that the person who is your proxy holder kind of has that as a life raft to look to if they're in that posture of having to make a difficult decision. And as I understand it, and Barb could probably speak to this better than I, the reason why the healthcare proxy just appoints someone and says, Stan is unconscious, he can't make a medical decision, his healthcare proxy is his wife or his sibling, whoever gets appointed. The reason why you don't go into elaborate instructions is physicians don't want to be sitting there reading legalese to figure out what this person wants. The healthcare proxy just says the physician goes to person B and that person gives the answer. Next slide, please. So your will, this is again a document everybody's at least anecdotally familiar with. So this takes effect when you die and not before. Those other documents, by the way, the durable power of attorney, healthcare proxy, and living will, at the moment of your death, those are basically torn up as a matter of law. Over the years, I've had any number of people that walk in say, mom or dad died last week, but I have his power of attorney, so I want to get into the safe deposit box. And the answer to that is, well, no. Once the person dies, all those documents are no longer legally operative. Your will then takes over. So some of the vocabulary, the person who makes the will, sometimes referred to as the testator or testatrix, those are male and female. The property that passes as a function of your will or through your will is called probate property or probate, the probate estate. The person who we think of as an executor, if your state has adopted something called the Uniform Probate Code, they no longer use the word executor or executrix, they say personal representative, but it's the same idea. And that's the fiduciary. That's the person whose job it is to execute your desires, to administer your will pursuant to your desire. Typically, a married couple will name each other as the executor of their wills. And then the survivor, again, typically an adult child or perhaps a sibling. The executor doesn't need to be a lawyer, doesn't need to be legally trained. If the state has any complexity at all, the fiduciary will hire an attorney who will help them with him or her with the administrative process. And then finally, your beneficiary is, again, the people or the institutions to whom you're leaving your assets. Next slide, please. Some miscellaneous definitions that I think are helpful. And one is non-probated property. So I just said that your will governs property that is within your probate estate. So there's this notion or this distinction of non-probate property. And the easiest example of that is a life insurance policy. If I have a life insurance policy with MetLife and it says, when I die, give the benefits to my wife. If I write a will that says, my MetLife policy number 12345, when I die, give the proceeds of that policy to the American Red Cross, that statement in my will has no legal effect at all. And the reason is that that life insurance benefit never gets into my probate estate. It's a contract between me and MetLife and they just pay per the beneficiary distinction. Similarly, if you own a house, typically, again, a married couple will own a house jointly with right of survivorship. So if our house is titled that way and I die, my spouse owns the house outright entirely at the moment of my death. So in my will, if I said I want my half of the house to go to the American Red Cross, it has no legal operative effect at all. So there are any asset that has a beneficiary designated or is jointly held with right of survivorship never goes into your wills. I had a married couple, the husband passed away. They held everything jointly. Anything that was in his name had appointed her as the beneficiary. And there was literally, he had a will, but there was literally no probate estate whatsoever. All the property just went to her by operation of the way it was titled. So another definition, intestacy. That means if you die without a will, the phrase "my last will and testament." So if you are intestate, you haven't written a will. Again, a popular misconception is if I have no will when I die, the state gets all my property or something. What happens is, I haven't literally looked it up in all 50 states, but I'm quite confident that in every state there is an intestacy statute. And in that statute, the state legislature makes a legislative presumption of what most people would likely do. So if you are married, it will say if I die without a will, so I'm intestate. If I'm married, it all goes to my spouse. If my spouse has predeceased me and I have children, it goes to my children equally. If I have no children, it goes to my siblings, et cetera, and it goes out in what they refer to as degrees of kindred. The point of that is it doesn't go to the state, but it also, if you have anything other than that legislative assumption that you want to have as your estate plan, you need to draft a will to do that. Finally, a definition of taxable estate. I just gave you the example of where there will sometimes be literally no probate estate, but all those other assets, my half interest in the house, my interest in my retirement accounts, all those things, if my estate is taxable, they will be within my taxable estate. So your probate estate, that which passes pursuant to your will, and your taxable estate are two different things. Next slide, please. So I'm going to do a quick who, what, where, when, why. So who should be straightforward, but you're going to think again globally about your family members, who you want to have as your fiduciaries, the people who will hold your powers of attorney, healthcare proxy, who will be your executor, who are going to be your beneficiaries. I would strongly recommend you work with an attorney. And then again, depending on the size of your estate, you would likely be involving your accountant and or your financial advisor in this estate planning process. But I would start with your estate planning attorney. Next slide, please. Again, the end of life incapacity planning has to do with those three documents I talked about that take effect while you are alive. Then your transmission of wealth, that's getting your wealth, whatever remains, to the next generation or generations. You can make inter vivos while you are alive. Lawyers love going to the Latin. Give gifts while you are alive. So that is a form of estate planning, is you're making gifts to family members while you're alive. Then the will we talked about is operative upon your death. Trusts can be in place while you are alive, or can take effect when you die, or be funded when you die. The simple distinction, when you have a will, it's the role of the executor just to distribute the money in accordance with the directives in the will. When you put property in trust, it is held by the trustee for the benefit of the beneficiary. So the beneficiaries don't get their hands on it. Next slide, please. So where you live at the time of your death is rather important, particularly as relates to estate taxes. Legal residency can be an important estate planning decision, depending on whether your estate is taxable. And I have in the bottom there's a reason why people retire to Florida. Florida has no state estate tax. So when you die, you can have either federal estate tax or state estate tax. The federal level is quite high now. It's $11.7 million, I think, for individual. For a married couple, that becomes 23.4. So if you don't have more money than that, there's nothing to worry about in terms of tax planning relative to your federal estate tax exposure. The 50 states can have their own estate tax. For example, Florida, and frankly, most states below south of Virginia, have no estate tax, but there are a number of states that do. Massachusetts has a very low estate tax exemption threshold, and I put quotes only $1 million. If you have $1 million, and again, if you own a home in Metro Boston, have a health insurance or have a retirement plan and some life insurance policies, you can very easily get over $1 million and be into a taxable estate circumstance. And there are tax planning tools, but again, I say to clients sometimes, really not jokingly, quite seriously, New York, I think, is 5 million, Vermont's 5 million. I don't have them off the top of my head, but if I have, $2 million and my spouse has already passed away, once your spouse passes away, your planning opportunities contract rather significantly in terms of tax planning. But I could move to Pownell, Vermont, and if I have less than $5 million, I have no estate tax. If I resided in Massachusetts, if I had only $1 million, now I'm in my estate is going to get taxed. So just when you sit down with your lawyer, be conscious of, and you can talk with them about that, whether establishing residency in a different state is something you ought to think about. Next slide, please. So when I would, some of you may already have an estate plan. If you have, that's great. There'll be a subsequent slide when I say you want to revisit it from time to time. If you do not currently have one, I'd say now, no time like the present. There's always something better to do on any given day than contemplate your mortality. So, estate planning is one of these things that lends itself to procrastination, but it's something that you should do. And one side comment on the inter vivos gifts, I've had people say, well, I'm going to just give everything to my kids and that way I have to deal with any of this. I had a law school professor, transmission of wealth class, who said whenever he had a client that said that to him, he would tell them to go read King Lear. And those of you who aren't familiar with King Lear, basically King Lear gives his kingdom to his two of his three daughters, and they proceed to treat him very badly. And the story of the prodigal son, again, if you give too much to people, particularly when they're young and they don't have particularly good judgment, it can lead to the money disappearing. Next slide, please. So, and the why of estate planning, and I'll again just hit this quickly. If you are in a taxable estate circumstance, you stand to save a significant amount of money, by just structuring your estate in a way that is intended to save money. If you can do, again, if your assets are more modest, a certain amount of what's referred to as Medicaid planning, which relates to being able to qualify for Medicaid if you end up in a nursing home. Again, that planning is very specialized. You don't want to just like read an article online and think you've figured it out. If you have a good estate plan, there will be procedural clarity when you pass away. So again, for your survivors, it will save money, and it will certainly save a lot of heartache and confusion if your estate plan is not well done. Next slide, please. And you will also preserve family peace. Again, clarity. People may, whoever you leave your estate to may not like what you've decided, but if it is clear, the only person they have to blame is you, who by that point is gone. There's also something referred to as special needs trusts. So even if people have had several clients who don't have particularly large assets, but have children with special needs, and there are trusts that are designed to set aside a certain amount of money for a person with special needs in anticipation of them not being disqualified from various publicly available benefits as a result of the funding. But again, I'm just touching on it as a concept to be aware of, and a reason why you want to talk to an estate planning attorney. Obviously, if you have charitable intentions, there's great opportunities there. And finally, so that you see that your will, whatever that is served. So these are all good reasons why you should do your estate plan. Next slide, please. So again, recap the basic documents: while you're alive, durable power of attorney, healthcare proxy, and living will. Next slide, please. When you die, your will is the one that will control. And then next slide, please. Oh, I'm sorry, you know what? Go back to, if that's possible. Yeah, thanks. So the other one is trust. And again, trust, it's a huge topic. Nothing I can do in the time allotted, but just, I'll tick them off. There's something called AB, revocable living trusts. That's how you save, again, for estate tax planning. Q-tip trust, qualified terminal interest property trust. SLATs, spousal lifetime asset trust. CRUT, charitable remainder unit trust. GRAT, grantor retained unit trust. So it's complicated stuff. I describe it as sort of this endless game of cat and mouse between very, very talented attorneys and the various revenue generating entities in our state and federal governments. It's all again, it's what these people do and do well. They are worth what you pay them, but it's complicated stuff. So when you think globally about your circumstance and you go talk to your attorney, ask them about whether your goals would involve the need for trust planning. Next slide, please. So plan to revisit your plan, periodically, whatever interval you want to pick, 5 years. Some people think it's not a set it and forget it. I did my will and I'm never going to think about it again. You should revisit it, and certainly think about it and think about revisiting it seriously if there is a significant change in your life circumstance. You either I've had folks who have a fairly modest life and they inherit a lot of money as adults. And well, they did a will 5 years ago prior to the inheritance. Now their circumstance has changed dramatically. It's time to go back to that estate plan and make sure it's commensurate with your financial circumstances. Likewise, if unfortunately there is a downturn in your circumstances, either health or finances, and you've got this big elaborate estate plan, it's not going to necessarily be it may be unnecessarily complex for the circumstance that you find yourself in. Next slide, please. So to get started, I think, again, I keep coming back to think about your circumstance globally, think about your assets. You don't have to have everything appraised and everything down to the dime. I tell people if you're within $10,000, $20,000, $30,000 as you like the value of the house, the value of any high value objects you own, if you own art or jewelry, things like that, your savings, your retirement accounts, your life insurance policies, your other assets, anticipated assets, that would be an anticipated inheritance. Don't let a chase for that detail bog you down in terms of starting this process. A good estate planning attorney is going to want to know the nature of the assets and the rough orders of magnitude. You can get to detail later, because among other things, you do the estate plan today and you die 10 years from now, 20 years from now, all those numbers are going to change anyway, but it will frame the exercise that needs to be done. Next slide, please. So again, think globally, identify and prioritize your objectives and your concerns, and then make an appointment to see a good estate planning attorney. Next slide, and that's it. Thank you, and I think we'll be ready to field questions at this point.
Okay, so I saw some questions in the chat. Let me see if I can find them. Okay, so Peter asked, can you talk about the relationship between Medicare and the Federal Employee Health Benefits Program if you're retired? There are, my understanding is that there's certain programs that are considered with Medicare, one of which is the railroad retirement retirement benefits. And also if you're getting Social Security, my suggestion would be to contact Medicare, and something that I'll just mention again, they have a live chat, which I found very helpful. I had used them a couple of times. So I would, for that specific question, I would reach out to them. And then John asked, if I'm working, are there penalties for applying after age 65 for parts B through G? Assume we apply for A on time, can we apply for other plans after we stop? The answer to that question is there are no penalties and you can apply for additional. If you're working, and this is for everybody, the most important thing is apply for Part A. And to get that, you can add other plans afterwards, but you definitely want to get into the Medicare system. Are there any other questions, and do people want to put them in the chat? I will say, I've been through this with 2 family members recently, and I've had to help some of my patients navigate this process. And just over the past couple of months, when just talking with people have provided some questions to me. which I can share because I think these are questions that are going to appear. Are there any other questions that people want to raise their hand, or should, can we unmute the group?
Yep, people can unmute themselves and ask questions.
Okay.
And there's a couple questions in the chat as well.
Okay. I'm just trying to see.
So I can speak to a question from Blake Noyes about having a child overseas, an adult child overseas, serving as an executor, and if that will create difficulties. I really don't think so. I think if that's the person, you know, whom you wish to have in that role, there's very little, particularly if the family is, if there's no contest involved, which is very rare, by the way. I mean, they happen, they're unfortunate when they happen, but most estate administrations are fairly smooth. And so if the family is essentially on the same page, there's typically not very much that needs to happen in sort of an emergency posture. So if there's a document that needs to get some kind of formal signature on, you know, it's an apostille, I guess you get overseas. But there are, it's short answer is I would not, if the person you want resides overseas, I would not be I wouldn't not have the person be your fiduciary if that's who you want. Thanks.
Okay. Sue asked, do you apply for Medicare while working? If you're in that 6-month window, I would definitely say chances are that someone who's working full-time, and there are people who work into their 80s and they apply for Medicare in that window. You cannot have employer-sponsored insurance, and you can have employer-sponsored insurance in Part A, but you can't have employer-sponsored insurance with Part B, D, and G. I mean, I'll give you an example. I don't think he would mind me saying this, but my husband, who's in the class of 78, he's working full-time. He enjoys working, and he is not talking about retirement yet. But last year he applied. He's got benefits, he's working full-time, and he applied for Part A. So Part A is his secondary insurance. So you should still, I encourage everybody to at least apply for what is original or straight Part A. And it'll be a second, if you have employer-sponsored insurance, or if you have another type of insurance, it'll be your secondary insurance. It'll be a hospital insurance. Any other questions? Because we still have a few more minutes, and I do have some questions that have come up. Anybody before I? Okay, so this was something that I was asked. Can I add, so if I have employer-sponsored insurance and I retire at 65 and get Medicare, but I have my spouse on my employer-sponsored insurance, I retire and I take Part C, which is hospital, outpatient, and drug and medication. Can my spouse be covered? When you apply for Medicare, it's for one person, and that's you. So your spouse would have to get, if they're 65 or over, they would have to apply for a Medicare policy or take out another, what they call market insurance. Which also, this is another question. So if I'm retired, let's say I retire and I have, and this does occur, I have dependents or children who are under 26 who were covered by my employer's insurance, and I retire. Will they be, can I cover them with my Medicare? And the answer, my Medicare, the answer is no. So they would have to get marketplace insurance. Okay, now this is another one, and this came up at my medical center. So if I get Medicare Advantage, which covers hospitalization, outpatient, and medication, what if my doctor or my healthcare system no longer accepts my Medicare Advantage plan? So like say if it's Blue Cross Blue Shield or any of these, or United Healthcare. Well, this actually happened at my healthcare system last year, and I won't mention the plan, but there was a plan, insurance plan that they'd used for many years. They were trying to renegotiate the contract. It fell through. So you've got, and it's Montefiore is a big health system. If you had that insurance, it was no longer accepted at Montefiore. So you had to get another doctor. I think many people have seen this happen before, where you find that your doctor or your health system is no longer taking your insurance, and you've got to find another medical provider or another health system. And then what you would do is that you could re-enroll in another plan in the next open enrollment plan. Okay, and again, this is a question. If I'm still working and I retire after 65, will I be penalized? You will not be penalized if you want to get Part B and the other parts, but you should, I can't stress this enough, everybody listening to this should understand this. Before you are 63 years and 3 months, you should apply for Part A Medicare. Because after that period, you're going to start paying penalties, and they're expensive, and you can't go back. They won't erase them. They will be with you for the rest of your life. So if you're still working, and I recommend that you start your application process 3 months before you turn 65. So it gives you a chance to, to get your documents, make sure everything is straight. Now, someone raised their hand. I saw someone. Okay. Can I change my plan if I submit my application before my enrollment period ends? So let's say you submit your plan, you've gone and you've done your research, you're 65, and you still have it's 3 months early before your enrollment period closes, and then you decide you want to change your plan. Can you say, well, I want to go back and I don't want to use Blue Cross Blue Shield. I want to use, I'm just trying to think, GHI or another plan. The answer is no. So that's why it's important that you do your research to make sure you get the right plan for you. And this is a question that also comes up. How do I know if I've been paying Medicare taxes? Most people know whether they're paying Medicare taxes. But by and large, someone who is not working is not paying Medicare taxes. And even if you're paying them, you have to have paid them for a certain period of time. I have to go back and look and see. But let's say, for example, you're 64 and you haven't worked for most of your life, and at 64 you decide, I'm going to start working because I understand I can get Part A premium free. Well, it doesn't quite work that way. You have to have been working for a while and contributing to your Medicare taxes in order to get premium free Medicare. I would imagine for many people, and if you go and open a Social Security account, you can basically see what you've been paying since you were a teenager, if your first job was when you were a teenager. But I would imagine many people have been paying Medicare taxes. If you're not paying through your job, it's when you file your taxes in April. I'm just trying to see here. Okay, so Charlie asked, does Part A original Medicare primarily cover hospitalization? Yes, it does. And again, we'll wrap this up in the summary. And we realize this is a lot of information for people. We have summarized the two parts of this presentation. And Stan will tell you about what we're going to do next as we close out the session.
So within the next couple of days, everybody on the listserv will get an email, which will have a link to the program. So it's being videoed. So if somebody's watching the Red Sox and the Yankees, they'll be able to come back and watch this at their convenience. There will also be links to some of the resources related to these topics. And also we'll have some attachments summarizing our presentations. So if you were not taking notes, that's just fine. It should serve as just a resource if you want to get back into what we've done here tonight. And again, Barbara and I have both said it multiple times. What we're doing tonight really is just very much at the surface of these topics, just to sort of alert you to some of the basic considerations, and then you kind of take it from here.
Any other questions? Okay, so as Stan said, we're fully aware that New York is in Boston. So we thank you for taking off the time. We have a suspicion that some people have two screens. One is on this one and the other is watching the game. So, but thank you for taking the time, and go Yankees.
Mark, can I ask you a quick question?
Ask who?
Peter Wells here, asking a quick question.
Yeah.
Because I'm on the site right now applying for benefits, and it came to the question, do you want to enroll in Medicare Part B? And so I'll be 65 in November, but I'll still be working. I'll still be getting health benefits, from my employer. So do I want, when this asks, do you want to enroll in Medicare Part B, yes or no? What am I clicking?
My understanding, okay, so I help someone else navigate this. Okay, first of all, if you're going to get Part B, you have to have Part A. From almost all these, you have to have Part A. Now, this is what my husband was advised. If he had, because if you get Part B, you're going to have to pay for that. Right now, I would assume that if you're working, you're going to get Part A for free. So what they told him is if he has insurance through his employer, he doesn't need to pay for additional service insurance through Part B. So from what you're telling me, it sounds like all you need is Part A. If you're getting, and I'm not sure what your job insurance, your employer sponsored insurance is, but it sounds like you've got some hospitalization, you've got outpatient, you're probably getting medications paid for, and there's some other services. Right. So to get Part B, you'd be paying extra for that. Okay. All right. So that's what that's from what you're telling me, but what you can also do is call, you can even do the live chat, because if you call the 800 number, you're going to be waiting for a long time. But if you do like when I do the live chat, they must have, I don't know how many people doing these live chats. Okay. And they respond very quickly. I suspect they're going to tell you that you don't need Part B, but you could, contact Medicare and find out. Okay, great. Thank you. Okay, so I believe that that's it. Thank everyone for checking in. It's 8:30. We'll let people go. And stay healthy and well, and please make it to age 65 and beyond. Okay, take care.
Thank you.
All right, bye.
Bye.